focusing on you. Innovations in modern medicine from your team of experts at UHealth, the University of Miami Health System.
The numbness started in my pinky finger, and then it kind of spread all through my hand.
April Bowers dismissed tingling, numbness, and trouble speaking as nothing more than a bad migraine. But when it happened again, she sought help from stroke experts at UHealth.
That's when they found that I had the dissection.
Vascular imaging revealed a tear, also called a dissection, in April's carotid artery, which supplies blood to the brain. Neurologist Dr. Negar Asdaghi says it is a common cause of stroke in people younger than 50.
Most studies have shown that about 10% of these people will go on to have another stroke, a bigger event.
During a stroke, every minute is critical. That's why the stroke team here at UHealth practices something called negative door time, administering care to patients before they even get inside.
The sun shouldn't set on a person with TIA and mild stroke without having had proper neurological investigation.
Dr. Asdaghi has established a treatment plan for April that should prevent future strokes.
I feel like I've been giving the blessing of a warning.
We've worked diligently to ensure that our systems of care are attuned to all nuances and time sensitivity of treatment and diagnosis.